Fixing tendon issues with training. Now, you develop tendon issues after years of training, and this is pretty common, and many have had this happen to them. So in this video, I'm going to explain how to fix this. Now, when tendon issues occur, many have a tendency to lighten the load and use less intense training methods in order to work around the pain. Now, when we lighten the load, of course, and the intensity, we are now effectively on the slippery slope to movement decline associated with old age. And of course, we don't want that. Now, if you have pain and inflammation, then watch the video that I'm going to put up next, which will probably be entitled Post-Injury Inflammation Strategy. Follow the strategies, heal yourself, and when you are on the mend, it's time to start increasing tendon load tolerance. Tendon load tolerance is the secret to better and more effective injury recovery, and it will also help with injury prevention. Now, a common thing with tendon issues is that you can recover or seem to recover and believe that you fixed the problem, but then when you attempt to resume training at normal loads and intensities, the nagging tendon pain and joint problems reappear. But the trick is to slightly change your training methods. And this is where dedicated connective tissue training comes in. Now, let's first consider the mechanics of training, and by this I mean the various contraction types. Concentric contractions are where the muscle contracts and at the same time shortens whilst under load. Now, an example of a concentric contraction is the lifting the weights up and away from the ground during a bicep curl. It's the contraction, the muscle is contracted, but it's shortened. Now, concentrics are considered to be the lifting phase of any exercise. The force applied is generally greater than the resistance against that movement. Now, eccentric movements during the lowering phase of any force-generating contractions occur to counterbalance the weight or resistance during this lowering movement. Now, as the muscle is lengthening, the non-contractile components, which are tendons and connective tissues, absorb a greater amount of tensile forces than they do during concentric movements. Concentrics shorten muscle length and connective tissues follow suit. They are under tension, but they've become shorter. Now, eccentrics lengthen the muscle and the connective tissues are stretching and they become tense while they're under load. So when performing explosive movements during weight training on the concentric and slower and more controlled movements during the eccentric phase, this can significantly reduce injury risk and help in the preservation of joint function. Now, even if you currently have no tendon issues, start using slow eccentrics when practicing any strength training or any gym work with heavier weights. This will reduce the risk of injuries to tendons and help develop tendon load tolerance at the same time. Now, this will keep you training for longer in life without debilitating injuries cropping up later on. Performing the eccentric with an equally explosive force and explosive motion is more likely to result in a rupture or tear to connective tissues than is the case with an explosive eccentric. Think of this like an elastic band. When it stretches, the likelihood of it breaking is increased. If you pull sharply with a quick motion on the band, the risk of it breaking is increased even more, and it's the same with tendons and connective tissues. Slow eccentric training emphasizes the slowing down of the lowering phase of any exercise to challenge the muscle's ability to lengthen while under a heavy load. An isometric contraction is when there is force generation without muscle length being altered in any way. A simple example would be you push against a wall, your muscles become tensed up while generating force against an immovable object, which is the wall. You cannot move the wall, but you can generate a significant amount of force by doing this. Because there is no movement, the muscle neither lengthens nor shortens, but instead contracts while remaining exactly the same length. Now, the muscle's length does not change. An isometric contraction can be performed during any phase of a movement by just stopping the motion. Bicep curl, if you stop the motion here on the way down, for example, and stay still, that's an isometric contraction. And exercises such as the plank, wall sits, performing horse stance are all examples of isometric contractions. So this means that during an isometric contraction, the connective tissues experience increased tension and strain without the corresponding stretch and recoil that occurs during normal explosive contractions. This leads to increased potential adaptations such as increased stiffness and strength within connective tissues due to the sustained force applied to them. This makes isometric contractions an excellent training mechanism for targeting connective tissues, strengthening and increasing load tolerance. With repeated isometric training, the connective tissues can adapt by becoming stiffer, which will result in the muscle's ability to generate force at specific joint angles, resulting in increased load tolerance and strengthening of connective tissues around joints, and this will create more stable and resilient joints. Great for the long term. Isometric training is effective in reducing joint pain combined with a low risk of injuries, making this highly effective for reversing joint pain and increasing muscle strength at the same time. You can add load to connective tissues without much likelihood of aggravating existing injuries because the tendons are not moving, they're staying still. Isometrics also utilize more motor units and create more force production than conventional resistance training, again at a reduced risk of injury. Studies have also demonstrated that isometric training helps to prevent bone density decline associated with aging, and if you want examples, go and look. If you are watching my channel, then I credit you with the intelligence of being able to find these studies for yourself. Now, if you are currently experiencing joint pain or any connective tissue dysfunction or discomfort, isometric contractions placed at around the halfway point of the movement range of motion helps to reduce joint pain and build load tolerance at the same time without stressing the tendons or any other connective tissues. I'll quickly demonstrate that for you. Now imagine I'm on the floor and I'm about to do kind of halfway, I'm about to do a push-up and my arm is in this position. This would be an ideal point, the midway point to kind of ideal point at which to place this isometric contraction. Now this makes this a particularly effective in cases of tendinopathy. If you were experiencing any pain or discomfort with conventional exercise patterns, isometrics are a useful way of stimulating muscles without aggravating the injuries. This makes isometric training a highly valuable strategy for injury recovery and with better outcomes for that injury being permanently consigned to the past. And because the benefits of increasing load tolerance in connective tissues, isometrics makes a good training method to be added to your regular routine, regardless of whether you've got any current injuries or not. Now, in cases of treating joint pain, when load tolerance is increased and stability has been restored to the joint, then slow eccentric training can be introduced. You could incorporate, combine these two methods together, it's equally as effective. Now, slow rep training then takes this a step further and recruits both concentric and eccentric phases under load, but with slower and more exaggerated movements. For example, you take back to the bicep curl, you will take about 3 to 5 seconds to contract on the concentric, and then about 3 to 5 seconds to lower that back down again onto the eccentric, more exaggerated movements. Emphasis is placed on both phases of the movement as opposed to only the eccentric phase. This is extremely useful for recovery purposes, increasing load tolerance safely and without aggravating any existing joint pain. You can also increase load tolerance by employing slow rep training into your routine. Now, the idea with this is to progressively increase resistance every few sessions, reducing the number of repetitions performed as the weight increases, but only increase the resistance or weight when you feel comfortable doing this. Patience is the key. And that's the most important thing. Patience is the key. Take note of that phrase. What you should ideally be aiming for is increasing load tolerance at a weight or resistance level that does not trigger a severe pain response. The old 1 to 10 scale of pain. How much pain do you feel on a scale of 1 to 10? You want to be at a 3 or less, ideally. If you experience a pain response, then just reduce the weight that you can use without any pain response, or as a lower pain response. Now, an example would be to start with a light weight which you can perform 15 slow, completely controlled reps, and then gradually progress by increasing the weight and reducing the number of repetitions. Employ this reasoning also when you're doing slow eccentric training. This gradually increases load tolerance of the connective tissues. Now, while this is a good rehabilitation exercise method, it's also very useful to include into any complete and varied training routine. In studies, I trust you have the intelligence to go and find these for yourself. In studies, it's been found that slow repetition training results in enhanced tendon adaptations and strengthened connective tissues, whereas muscle tissue seems to respond to a wider range of movement and movement tempo approaches. Connective tissue is responsive only to increasing load tolerance, with increased loads combined with slower controlled reps or controlled, exaggerated slower movements. And this is the secret to preservation and optimization of connective tissues. Studies, again, I trust that you have the intelligence to go and find these for yourself. Studies have shown that explosive movements such as sprinting, plyometrics, and high tempo movements do not consistently increase connective tissue adaptations in the same way. But of course, I'm not condemning this type of training. I'm an advocate of a complete and varied training regime covering all bases. I sprint, I do plyometrics, and I use explosive movements too. Now, the popular consensus is that light training with lighter weights and higher volume, higher numbers of reps, is the norm, especially when encountering joint pain. This can help with maintenance of muscle mass to a degree, but this strategy completely neglects connective tissue adaptations or increasing load tolerance. So you are never actually addressing the root cause to the problem, and you have suffered a decrease in training effect by going lighter to work your way around the pain. Now, to increase load tolerance and for the connective tissues to adapt, an increased load is needed to get that effect. You've got to keep building the load back up and increasing and developing load tolerance. Also consider that if you're always training lighter weights with higher reps and neglecting connective tissue load tolerance, this is also going to increase the likelihood of repetitive use injuries. Now, although this method is effective, it should not be used all the time. Don't misunderstand me here. It can be counterproductive and very time consuming to employ this method on every movement in every workout. You will end up, training for hours at a time, because it takes a lot of time to do this. Its primary benefit is to increase load tolerance to connective tissues, and this is what you should be using this technique for: injury recovery and injury prevention. Many studies demonstrate that this slow rep style training is not as effective for strength or muscle when compared to traditional training at normal tempo. You know, there are positives and negatives to everything, but it is an extremely effective therapy intervention, and even in the absence of joint pain or injuries, it can be effectively employed as part of any training routine. The benefits of improved load tolerance to connective tissues and injury prevention cannot be disputed. You know, when you're injured, you know, you're down and out almost. After all, tendon and ligament ruptures and tears are extremely common injuries in training men. Now, it can be a good idea to either train this method once a week as a preventative measure, dedicate one workout per week to focused on connective tissues, or you can include a few sets at slow tempo in your regular workouts. You know, a good approach here would be set 1 of 3 at a slow tempo, and then sets 2 and 3 at a normal tempo. Or you could even do 3 sets of your first exercise for each muscle group using this method. Now, a 3-second slow eccentric is adequate to get the adaptive response to connective tissues during normal training. If you prefer, slow reps with a slower concentric and eccentric, or eccentric even, can be reserved for times when you are looking to increase connective tissue load tolerance and to prepare for strength gains. Controlling the eccentric during explosive movements is very beneficial to improving overall performance. You know, and I highly recommend that whenever you are focusing on strength training and lifting heavy weights, to do controlled eccentrics, because it will seriously reduce the risk of injury. Now, explosive movements such as jumping, sprinting, squatting with fast tempo, changing movement direction really quickly, explosive push-ups, punching, kicking, these methods all train muscles to lengthen safely and to contract explosively and with force. And explosive movements are vastly superior for activating fast twitch muscle fibers. So if you neglect this element to train only slow tempo movements all the time, then it's going to have a negative effect. You know, I'm an advocate of a complete and varied training routine. Now, loss of fast twitch muscle fibers does contribute towards movement decline in older age, so you need to bring this also under your attention. Movements become slower because fast twitch muscle fibers have been neglected. You should include a variety. You know, key takeaway from this video, you should include a variety of movement tempos and variations in your training routine at all ages, at all times. Subscribe and follow for more.